My name is Brad Hagan. I'm currently an associate professor at the University of Lethbridge in their School of Health Sciences. The way we set up the educational videotape series is the most likely scenarios that students would have to encounter. The first thing we want to show students is some of the common errors or some of the small, subtle mistakes that students might make when they first try working with these people. So we thought it'd be really helpful just for students to maybe see themselves as novice students and some of the things they might run into problems with. Then the second thing we'll see is a second scenario where we see a more expert or a more proficient nurse and some of the skills, the advanced skills that he or she might bring to that scenario. In this vignette, you're going to see a nurse working with a person who has Alzheimer's disease, which is the most common form of dementia. As you may already know, Alzheimer's disease is a brain disease and is quite a tragic disease in that the person may be physically healthy, but who they are as a person is slowly being taken away. Because it's a brain disease, it damages such things as persons' orientation, their sense of time, their memory, and their ability to judge who people are, where they are, and make decisions. Consequently, it can be extremely challenging for nurses to work with people with dementias like Alzheimer's disease. In the first vignette, you're going to see a nurse who's trying to comfort and reorient an older gentleman who appears lost and appears to still believe he's a farmer somewhere and is worried about his cows not being looked after. You'll see, however, in the first scenario that her attempts to comfort and reassure him in the end actually only make things worse. In the second scenario, you'll see a more expert or proficient nurse using some very subtle but very interesting techniques to try and make this gentleman feel more safe and comfortable and secure.
Get me the hell out of here! Get me the hell out of... Get me the hell out of
Mr. Roberts,
here!
Mr. Roberts, what's wrong, Mr. Roberts?
Get me the hell out of here! I gotta be out there and working. Look at them. They're starving, for God's sake.
Who's starving? Mr. Roberts, look, there's nobody out there. Now, Mr. Roberts, look, stop banging on the glass now, okay?
Please.
There's nothing to be so upset about.
Let me out of here. There's nobody there. I gotta get outside and feed the cows. Need someone to feed them. The cows are gonna starve.
Mr. Roberts, look, there's nobody out there now, see? It's an empty field. Just relax, Mr. Roberts, okay? Look, I'm gonna take you, Mr. Roberts, I'm gonna take you, we're gonna get you something to drink, okay?
Help! Leave me alone.
Mr. Roberts, it's okay. Everything's okay. It's Jennifer. It's okay. Look, there's no need to get upset.
God damn you!
Okay, Mr.
Leave
Roberts,
me alone.
now please stay here. I'm gonna get some help, okay?
Let me go! Help! 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 Get me the hell out of... Get me the hell out of here! Get me out of here! Get me the hell...
Mr. Roberts, what's wrong?
Get me the hell out of here! I gotta get out there! Look at them! There's...
Mr. Roberts, it's okay. You seem very upset. Can I help you?
Yes, God damn it! Look, the cows need... Let me go, please. Let me
Mr.
go.
Roberts, I'd like to help. I'm here to help you. Your cows? You seem upset about your cows, that nobody's feeding them. And you're upset and worried about your cows. Is that right, Mr. Roberts?
Yeah. For God's sake, let me get out of here.
Mr. Roberts, I can help you. Okay? We've taken care of your cows, Mr. Roberts. We fed your cows about an hour ago. You don't need to worry.
My cows? Well, My cows need food. Please, let me go home.
Mr. Roberts, we will look after your worries, okay? We fed your cows. There's no need to worry. Everybody's okay. Your cows are safe, Mr. Roberts. We had someone feed them, and your cows are safe.
Where do I...
Mr. Roberts, you are safe. You're safe, Mr. Roberts. Your cows are safe. Everything's been taken care of.
Well, what do you need? What do you...
You are just fine, Mr. Roberts. And I'll help you, Mr. Roberts. I'll help you find your home. Look, Mr. Roberts, do you see out there? Do you see that lady coming right up the walk?
Where?
Well, she's coming right up the walk. What a beautiful red coat she has on. Do you see her red coat, Mr. Roberts?
Yeah.
Yeah, I bet she's coming here to visit someone in their home.
Yeah.
Mr. Roberts, I bet that you were a really hard worker when you were on your farm. I bet you were a hard worker. And you know what? We're about to go and get ready for lunch. I could use your help getting ready for lunch, Mr. Roberts.
Well, where do I
You
go?
just come with me, Mr. Roberts, okay? And we'll go wipe some tables, okay, Mr. Roberts?
Okay.
Okay. And Mr. Roberts, what a lovely shirt you have on. Oh, it's so soft. Isn't that a lovely shirt?
Yeah.
Yeah.
Some of you may have relatives or know people that have had a disease like Alzheimer's disease. If so, you know that this disease affects the person's mind. And in that regard, it's quite a tragic disease in that the person may be physically healthy, but the disease robs them of who they are as a person and their personality. Because it's a brain disease, it affects such things as memory, judgment, orientation, and the ability to communicate. Consequently, it can be extremely difficult for nurses to care for these people. In this scenario, we have a client who's experiencing profound anxiety. So once again, such as with depression, most of us, including most student nurses, all experience anxiety. We're quite familiar with anxiety in this world we live in. So if you're a student nurse, you might be anxious about final exams, or you might even be anxious about your mental health nursing practicum. But for some people, anxiety gets out of control, and they can no longer use the kinds of things we do to cope with anxiety, such as exercise or faith or visiting with friends and family. So with these persons, as you'll see in this scenario, the anxiety takes over. They can no longer cope with the anxiety. And we have two versions of this. In the first vignette, you'll see the novice nurse is trying to help the person with anxiety, but becomes quite anxious and gets involved in some of the anxiety over medications, which can be quite common with these people. In the second scenario, you'll see a more expert or proficient nurse that uses some advanced skills and techniques to help the person regain some control over their anxiety.
Hi, I'm looking for my nurse. I can't remember who my nurse is, though.
Rebecca, I'm your nurse. What's up?
I need another Ativan. That one that you gave me, it didn't do anything.
Well, Rebecca, I found your medication record right here. I gave you that Ativan just half an hour ago.
Yeah.
So I'm really sorry, but according to your orders here, I can't give you another one for 3.5 hours.
Yeah, but You don't understand. You got to trust me on this one. That one, it didn't do anything. So I need another one.
Rebecca, look, I'm really sorry, but I just checked the orders again, and there's nothing else I can give you right now. I'm really sorry. I'd like to help you out, but I've given you the most that I can give you right now. What about that relaxation tape you had in your room? Have you tried that? Or how about just lying down for a bit?
Okay. I'm getting a little tired of this crap. I came here for some help, and I'm not getting any fucking help. You and the doctors don't seem to give a shit about me. You care about your torts and your stupid orders. And then I could die in here, and nobody seems to care.
Rebecca, like I said before, I'd like to help you out. I really would.
You gotta give me another pill.
But with the orders the way they are, I can't give you another Ativan for 3.5 hours. I don't think the doctor wanted your orders changed. Now, how about that tape we talked about? You were telling me how it helped you to take your mind off your kids and all your worries. I think you're really just getting yourself worked up here.
Of course I'm getting worked up. Nobody around here seems to give a shit about how I feel. Of course I'm getting worked up. Look, why don't you just pick up the phone and just call the doctor and I just need one more Ativan. That's all I need. Isn't that your job? Is that what they pay you for?
If the doctor had wanted your orders changed, the doctor would have changed the orders. I think you're just getting yourself worked up over nothing here. I think maybe you're letting all this stress about your kids and things get to you. Why don't you please, just go to your room and lay down for a bit, and I'll come and see you in a little bit. Lunch will be here soon. I'll call you when that comes.
I can't lay down. I can't sit still. I feel like I'm going to explode, okay? Look, please, just phone the doctor, okay? Or maybe you could just get me something. I feel like I'm gonna go crazy, really.
All right, I'll see what I can do. I'll call him, but I don't know how long it'll be before he calls back, and I really don't know what his answer will be, okay? I just wish you would just go and sit down, or watch some TV or something. It might help you to take your mind off things. I really think it would help you to not worry so much.
I'm just gonna stay here, all right? I'll just wait here until you hear from Dr. Evans. I feel really sick.
All right, I'll call him right now.
Okay.
Please, just sit down, okay? And I'll come and get you after lunch, and I'll tell you what's happening, okay?
Okay. Hi. I need to see my nurse. I can't remember who my nurse is.
Rebecca, I'm your nurse. What's up?
I need another Ativan. That one that you gave me, it didn't do anything. I need another one.
You do a little bit stressed out, and I'd like to help you out if I can. You know, I don't know about you, but even before we talk about your Ativan, how about if we get away from this nursing station and all the chaos here and go somewhere where we can talk, all right?
Sure.
Okay. Okay? There. That's better. So, Rebecca, like I said, you're looking a little stressed out. Why don't you tell me what's going on?
Well, the Ativan that you gave me, it didn't do a thing, and I'm shaking. I feel like I'm going to be sick. It keeps getting worse. It's certainly not getting any better, and I don't know, I just feel like I'm gonna lose it, you know, like,
Yeah, I can see how tense you are. Look, I really want to help you out, because you shouldn't have to feel this anxious. Whereabouts in your body are you feeling it the most? Is it in your head, your back, your shoulders, your gut? Where?
I guess my stomach, I feel like I'm gonna be sick, and I'm just really freaked out.
Now, I really want to help you out, but I may have to ask you a few more questions, okay? Are you okay with me asking you a few quick questions?
Yes.
Okay. If you had to rate these feelings in your stomach, these sick and scared feelings, on a scale of 0 to 10, 0 being pretty good and 10 being absolutely horrible, where would they sit?
A 9. I'm feeling really horrible.
Oh, 9. That is really bad. When did it start getting worse than, say, 8?
I guess this morning, I woke up feeling really horrible, and then things just got worse and worse, and I couldn't control it anymore, and that's when I asked for the Ativan, but it didn't even touch it, and now I just feel like I'm gonna go crazy or something, and I just really feel like I'm gonna explode, and, you know.
Okay. Okay, so today sounds like it's a lot worse than yesterday.
Yeah.
Okay. What were you doing yesterday when it wasn't so bad? Is there any difference between yesterday and today?
I don't know, like, I'm just having a really crappy day. It's like everything's just kind of like moving in on me or something.
Yeah, it can be really scary when things are coming in at you. How is it right now, talking about all this stuff? How do you feel now compared to, say, half an hour ago?
I still feel really crappy. Can't I just get it out of it? These questions are not helping.
Yeah. Listen, Rebecca, I know you want another Ativan, okay? I hear you loud and clear. But you and I have talked about, you know, how these drugs are only a temporary solution, you know, and then they come with problems of their own later on.
Yeah.
Okay. We discussed how you can develop a dependency and then a tolerance for those drugs, and they don't really do anything after the first few weeks, right?
Right, sure. But I'm not planning on taking them for the rest of my life. I just really need one right now. And then I'd be fine.
Again, Rebecca, I hear you. And I know how difficult this is for you right now, okay? Would you be willing to try something with me?
What?
Well, while we've been sitting here talking, I've noticed that you've hardly been breathing at all. Would you be willing to take a few deep breaths with me?
I tried that crap. It doesn't work for me.
I know it sounds like crap, but I've seen it work for lots of other people. Now, will you just humor me? I could probably use a few deep breaths myself right now.
Sure. It'll make you feel better.
What'll make me feel better is to see you feeling better. Okay? Here's what we're going to do. I'm just going to take some deep breaths. You're going to follow along and do exactly as I do, okay? Okay, here we go. Well, let it out more slowly. That's better. That's really good. I know how difficult this probably is for you, and I want you to know I really appreciate you giving it a try. How are you feeling right now? How's that stomach of yours on a scale of 0 to 10?
A 6 or a 7, I guess.
Well, that's pretty good. Down from a 9 to a 6 with just a couple of deep breaths. Look, I know you're still feeling really anxious, okay? But you look a lot more in control now than you were just over at the nurse's station over there. You don't look like you're going to explode any second like you did a few minutes ago. I want you to know I really congratulate you making the effort to take care of yourself. And trying other options is good. I know how desperate you were for some relief.
Well, I still feel like crap. Can't I just try another Ativan? I don't see why I have to feel this way all day if I don't need to feel this way all day.
Yeah. Rebecca, you and I both know that the drugs help a little, but as you found out this morning, sometimes they can wear off really quickly. And then you just have to take more of them and more of them. Before you know it, the drugs are controlling you. Again, I really appreciate you trying to find other, healthier approaches to helping yourself. What you and I just did is a much better way of helping you control your anxiety. I want you to make me a promise.
What?
Whenever you start feeling like you're getting above a 7 or an 8 again, I want you to come and get me or one of the other nurses, and we'll come back here, and we'll sit down, and we'll help you do some deep breathing together, okay?
Okay.
Now, in the meantime, is there anything else you can think of that would help keep you from feeling more anxious?
You mean other than an Ativan?
I mean other than an Ativan.
I guess I could go to the gift store and look at some magazines or something.
That's a good idea. Take a little walk. A little exercise is a good intervention for anxiety. I think you should do that. See? We've already found 2 good strategies to help you get through the day. That's all you need to do is get through today. Don't have to worry about tomorrow. And remember, you don't have to do this by yourself. I'm here to help, and so are all the other nurses here. Okay?
Yeah.
You have a deal?
I guess.
Okay. I'm just going to go check on my other patients. But then I'm going to come back and see you. All right? Good work, Rebecca. We'll talk in a couple minutes, okay?
Okay.
And once again, like with depression, a lot of us can relate to anxiety. So most mental health nursing students get anxious around final exam time. Most of us get anxious for job interviews, and we all know what anxiety is like. It's just part of being human. But unfortunately, in certain individuals, anxiety takes over and it becomes a predominant thing in their life. And it also becomes so powerful that people can't cope with it anymore. So most of us are able to cope with anxiety either through our friends or exercise or faith life or meditation. But in these particular individuals, they cannot control their anxiety anymore. It takes over their life.